reason you don't know much about it is the hospitals don't want you to know about it because you're Americans. But the Canadians, who get tired of waiting for their knee replacement or their hip replacement, are coming down to the United States, and they're getting package prices, and they're about half of what Blue Cross pays, about half of what you and I would pay. And how do they get that? Because they are willing to travel, and they're willing to pay cash. They're willing to do those two things. Then you're in a market, or they can have access to a market, where hospitals will really compete for their business. I discovered something else, that you don't have to be a Canadian to do this. Americans can do this. You and I can do this. But again, we have to be willing to travel, and we have to be willing to pay cash up front for the surgery. And we not only can cut our costs in half, but we can end up paying a price that's not too much different from what we would be charged if we went all the way to India or to Thailand. So we can have high quality, low cost services for providers who are willing to access this market. And why does the hospital next door want you to know about this? Because traditionally, hospitals near where you live think they're going to get your business anyway. And so they don't feel like they have to compete for it. But if somebody from Canada picks up the phone and calls them, they know they're not going to get that pitch if they don't compete on pricing, they don't compete on quality. So do markets work in healthcare? Yes, they work very well. And that is the secret to solving our problems of cost, and quality, and access. Exactly the opposite approach is being taken in Washington. President Obama has said time and again how he views healthcare and how he wants to solve the problem. He says we're going to go out and we're going to find out what works, and then we're going to copy it. It's exactly the same thing he says about education. The only difference is in education, that's exactly what we've been trying to do for 25 years with no success. In healthcare, we've only been trying to do it for 6 or 7 or 8 years. The Congressional Budget Office has looked at the pilot programs and demonstration projects 3 different times, and on each occasion it says none of these things are working. When we look at the marketplace, we can find lots of examples of centers of excellence. We can find high quality, low cost healthcare. But in education as in healthcare, the market is a sea of mediocrity punctuated with these little islands of excellence. And the islands of excellence aren't correlated with anything. The islands of excellence occur because of the leadership and enthusiasm of just 1 or 2 people. And inevitably, they come into existence because of somebody on the supply side who decides to do something different. They never come into existence because of some payer, whether the payer is a corporation or insurance company or whether it is the government. We need to learn from that. We need to liberate the supply side of the market, not have the payers try to tell the doctors how to practice medicine, which is the direction which we're all going. Let me talk about Obamacare real quickly. I believe that even if there were no Republicans in Washington, if there were no critics of Obamacare in Washington, just Democrats, just people who voted for the bill, I think they are going to recognize pretty quickly that there's 6 big problems with Obamacare that are so serious that if they don't do something about them, they're going to have very, very serious problems. And I think before 2014, when Obamacare is supposed to kick in, that we are going to see a major reform of the reform. The problem number 1 is that you all are going to be forced to buy insurance whose cost is going to grow at twice the rate of growth of your income. Now, Barack Obama didn't create the problem. That's been going on for the last 40 years. And it's not just a U.S. problem, it's going on all over the world. Healthcare basically everywhere is growing at twice the rate of growth of our income. But you don't need to be an accountant or an economist, or you don't even need a pocket calculator to know that if you're buying something and it's growing twice as fast as your income, it's going to be pushing aside everything else you want to buy, right? In fact, if we continue on the path that we're on, by the time you folks get to the retirement age, we'll have crowded out everything else there is to consume. So you won't have anything to eat, nothing to wear, no place to live, but you're going to have lots and lots of health care. Obviously, that is an impossibility. We're going to have to get off of that path. Number 2, bizarre system of subsidies. The hotel where I'm staying at, not too far away. If you ever notice in a hotel, just about everybody you see is making about $15 an hour. These are the maids, the waitresses, the waiters, the busboys, the custodial people. That's mainly who works in a hotel. And we now have a law that says that hotel is going to have to provide very costly insurance. In fact, for a family plan, it costs about $15,000, which is about half these folks' annual income. So I can see it now. Call the employees in and say, we've got good news and bad news. The bad news is we're going to have to cut your wage in half. The good news is you're going to get a Obamacare. Now, as an alternative to that, we're going to have a new health insurance exchange where anybody who's not getting insurance from an employer can go get insurance, and it's going to be highly subsidized. And for people at this income level, it's almost all paid for by the government. So here we are with a group of employees, and if the employer continues, if the employer buys the insurance, they get no additional help from the legislation. If the employees go over to this new health insurance exchange, they get $15,000 worth of insurance, almost all of it paid for by taxpayers, which is better. Well, from the hotel's point of view, and even the employee's point of view, that second thing is obviously better. Now, what about the manager over at the hotel? Let's say he's making $100,000 a year. What if he goes over into health insurance exchange? Well, then he gets no subsidy at all. But if he gets health insurance from the employer can pay premiums with untaxed dollars. Those dollars are avoiding, say, 25% federal income tax, 15% payroll tax, FICA tax, another 4, 5, 6% state and local income tax. So the ability of employers to buy insurance for above average income folks is worth almost half the cost of insurance. So they get great tax relief. If the employer pays, they get nothing in exchange. So what I'm describing to you is a situation in which everybody who's making below average income is going to eventually get over in that exchange. Everybody who's above average income is going to be getting health insurance from an employer. Well, how will that happen? Well, maybe the employer will say to low-income folks, we're going to make all of you part-time, so we get around the law. We'll make you independent contractors. Or maybe we just divide the company into two parts. And one part employs lower-income people, does not insure them, pays a $2,000 fine, so they can go get $15,000 of insurance. And for the higher-income people, it provides insurance for them because that's what's in their self-interest to do. Folks, we don't want companies to merge, divide, organize in response to health subsidies. We want them to make these decisions based on economics. It's the only way we're going to be an efficient, competitive economy. Third problem. In this health insurance exchange, insurers are going to have to charge everyone the same premium regardless of their health status. And what that means is that whether you're sick or you're well, old, or young, you're basically going to be paying the same premium. Now, you don't have to be in the insurance business. You don't have to think about this for very long to realize that insurance companies are going to make profits if you're healthy, and they're going to make losses if you're sick. And so what they're going to do is they're going to try to attract the healthy and avoid the sick. All of you have seen on TV the commercials about the casualty insurers. One that I really like is for the black actor standing in front of the town. He said, it took 2 minutes to destroy this whole town. And then how does he conclude? He says, are you in good hands? Okay, that's the Allstate ad. Almost every Affleck ad is the same thing. Everything's going wrong. The insurance company is saying, we're going to be there for you when it does go wrong. My favorite print ad is the Chubb ad where the guy is fishing. He's about to go backwards over Niagara Falls. And the tagline there is, insurance doesn't matter till it matters. What all these casualty insurance companies are saying to you is that the reason you buy insurance is because if something goes wrong, you're going to need help. And when that wrong thing happens, we're going to be there for you. That's the way they advertise it. They try to sell you insurance based on your need for insurance. Well, in Washington, D.C., federal employees are in an exchange kind of like all of America is going to be in under Obamacare. And every year in the fall, in open season, they get to choose an insurance plan. Again, it's the same premium for everybody. What kind of advertisements do you think insurance companies put in front of federal employees in the Washington Post, the Hill, on television in Washington. What do you think those ads look like? Well, they never ever talk about why anybody would need insurance. They never mention cancer or AIDS or heart disease or any other problem that you might have. What they do is they show pictures of young, healthy families. And the implicit message is, if you look like the family in this photo, then you're perfect for us. And if you don't look like these folks, well, then maybe we're not a good fit. Totally different message. And it's a perverse message, because what that means is they're trying to attract the healthy and they want to avoid the sick. But this perverse incentive does not stop at the point of enrollment. It continues. And their incentive after enrollment is to over-provide to the healthy to keep the ones they have and attract more of them, but under-provide to the sick because they don't want the ones they have, they wish they would leave, and they certainly don't want to attract any more of them. Right now, for federal employees, the way the health plan works, it works as well as it does because you have an Office of Personnel Management. It's sort of riding herd on the whole thing. It's like one large HR department. But imagine that went away, and imagine you opened up the system to the whole city of Washington. What you have is a complete mess. Most people don't stop to think about the fact that the healthcare system is a very bureaucratic system. It can be a very impersonal system. It can be a very hostile system, especially if you've got real problems. And right now, you have protectors and defenders. If you're getting insurance through the employer or through the university, I mean, those entities are your protector and your defender. Or if you have an insurance broker. But if the employer goes away, the university goes away as your insurer, and if the brokers go away, then you're off on your own. And you're going to be dealing with a world in which if you have a problem, insurers really aren't going to want you. Fourth problem, sorry. On the buyer side, what happens if you don't buy the insurance? Well, there's supposed to be a fine. It's not very high. And it may not even be enforced. The IRS said the other day, we're not going to be enforcing this mandate. Well, what does that mean? That means it sort of opens the door to people to remain uninsured if you're healthy. Wait till you get sick. Then they have to sell it to you because that's the way the new rules work. And you get your health care, you get the bills paid, and then you can drop the insurance in. In Massachusetts, these are called jumpers and dumps. People jump in when they get sick, and then they dump the plan after they get their medical bills paid. But if everybody does this, then only sick people will be the only ones with insurance. And if the only people with insurance are sick, then the cost of insurance is going to be really, really high. Private insurance will essentially collapse in that kind of environment. Fifth problem, we're going to have a huge safety net problem. This legislation has way overpromised. It's promising benefits that cannot be delivered. I tried to explain this in Washington the other day about what happened in Massachusetts under Governor Romney. This one congressman said, well, isn't it good that we cut the number of uninsured in half in Massachusetts? And I said, yeah, that's good. But as far as I can tell, no one's getting any more health care. You didn't create any more doctors, no more nurses, no more clinics. If you don't do that, how are people going to get more care? Well, we're going to have the same problem nationwide. We're going to insure 30 million new people, and they'll try to double their consumption of care. And then all the rest of you will be required to have a whole long list of, you'll have to be required to pay for a whole long list of preventive services that you will have access to with no deductible, no co-payment. Once you have the ability to claim those benefits, many of you will try to get them. And when you do that, what I'm now describing is a huge increase in the demand for care, but there's nothing in the legislation which creates one new doctor. So we're going to have a big rationing problem. And in this rationing situation, all the times that I mentioned earlier are going to go longer. It's going to be harder to see a doctor. You'll wait longer before you see him or her. And in that environment, guess who the doctors are going to see first? They're going to see first the patients who are paying the highest rate. Who are those? Those are the people who get insurance from Blue Cross, people who get insurance from employers. Anyone who pays below market is going to be pushed into the waiting line. Who are those people? The elderly and the disabled on Medicare, poor people on Medicaid, and in Massachusetts is the example, the newly subsidized people in the health insurance exchanges. Who are these people? These are our most vulnerable populations, right? The people the Democrats thought they were trying to help when they voted for this bill are the ones who are going to have the greatest access problem of all. And I really think that access to health care for vulnerable populations is going to go down, not up under this legislation. A lot of other people think the same thing. You don't have to be a conservative critic. If you were running a safety net hospital, you'd have the very same work. And finally, for seniors, they really do get screwed. $716 billion out of Medicare over the next 10 years. And where's the money going? It's going to create subsidies for health insurance for young people. And the administration doesn't seem to want to talk about this. And when they do talk about it, they're completely misleading. They say, well, we haven't taken any benefits away from seniors. Well, no, on paper they didn't. But if you don't pay doctors very much money, we know it's going to be harder for people to get to see doctors. And in just a few years, the Medicare rate is going to fall below Medicaid. Seniors will be behind welfare mothers in terms of who's more financially attractive to doctors. And this is where the whole system is going to collapse. Cokie Roberts said on TV the other day, there's no way this is going to happen. The seniors will be on the phone, they'll be pressuring the politicians, they'll never let these cuts go through. And of course, if they don't, that means we never pay for any of this, which means higher and higher deficits going on in the future. Your assignment, and I'm going to let you ask me a question, is to give me an email address if you want a daily policy digest from the NCPA, which summarizes a whole broad range of think tank reports on all kinds of public policy issues. And if you really, really are interested in health care and health policy, then give me an email address and I will send you my health alerts, which come out twice a week. And then they will take you back to my blog where I hope you will comment along with other people who do that. You've been a very good audience, and thank you very much.
Thank you very much, John.